when the first panel payments came out. There was a lot of doctors that were like, this is a lot lower than I thought it was supposed to be.
Mm-hmm.
So, and I worked with a couple of them and I said, well, how are you doing your diagnostic coding? And we pulled some reports and found that 20% of the time they were using a 780 instead of using the more appropriate diagnostic codes for whatever that visit might be for those patients. And they did find that some of those codes were associated with some of their more complex patients. So they were able to see within a first couple of months of being on the new pay model what an impact that diagnostic coding was actually having on defining the complexity of their patients. Where in the past, that's something we've tried to teach in the system for a long time, and it never really got that uptake. Where I find now that it's tied to something that we can show right away, we're getting more interest in wanting to be an active part in making sure that those are coded more properly for diagnostics. So that has been a really interesting feedback from it, which I found was, I think, an unintended consequence of the program, but I have found has been a major benefit for my clients.
Very interesting. Like just drawing on my own experience there, and this is probably somewhat primitive from your perspective, but when I was taught in residency, it was, the only time the diagnostic code really mattered towards your billing was if you were putting in like a mental health billing code, and in which case it just had to start with a 300 something something. And then beyond that, it just never really mattered. And so that probably on the back end in terms of statistics and just, the health data tracking probably resulted in a lot of like not great data coming in the first place.
Well, you got to think our HQCA reports that we get that tell you, your percentage of diabetic patients. That's based on diagnostic coding. Same with the CIHI grouper. They base all that on diagnostic coding. So a lot of our healthcare data all across coast to coast here in Canada and provincially is based on that diagnostic coding, but we don't teach the importance of it in medical school, in nursing school. We don't highlight it as much as we probably should have.